Middle of the towel here, drag it up the side of the leg, keep the other edges of the towel nice and close to the leg there. Your other towel should be covering the top half, so we're all good. Keep that towel in there. Find the undies, tuck in. And this is what I said about we'd get around the greater trochanter, because there it is there. Okay, so as long as they're not wearing really big, heavy elastic undies that are going to sit here, normally you can get right up and around this hip. Okay, so tuck in there for us. Slight lift to that knee, underneath there, settle back down. Beautiful. Excellent exposure of the thigh to work on, and that drape sits there nice and tight, so you can get into it really easy. Okay, Miss Rita.
Okay.
I'm going to do the sole stretch at the end. I'm going to do them all together. So turn over.
Side leg draping,
Yep.
kneading to glutes, compression, light friction, greater trochanter, and glute crest.
Yeah. So what we want to do first is work all around this hip and glutes. This is actually a great way to get in through here, because I can feel not too much tension, a whole heap of tension through here, continuing, and then stopping around the back. So this is going to be a lot of glute med being quite tight through here. So effleurage, palm work, okay. You can actually bring, because she's quite tight up through here. You can bring the forearm up and around there as well. And so this is where you want it too high, or you're not going to be able to work through the side of the hip here. How's that feeling through there?
Tender.
Pretty tender? Yeah. Okay, let's scoot around the back. My best angle on the area I want to work on. Good. Yeah. Just make sure I'm not working too firmly through there. And so a lot of work just basically circling that greater trochanter, working all through glute min, glute med. This is where you can spend a good 5 or 10 minutes working through here if it is really, really tight. Because you're going to get, we kind of hit piriformis before, we're going to hit the edge of piriformis out here. We're going to be pulled tight in this position. Okay? And that's already starting to release off a bit, isn't it? How's it going pain-wise? Getting overworked, or is it pain going away?
Yeah, it's going away.
Yeah, so I've still got just that little bit around the greater trochanter there. And so I'm actually left with just a nice little tight spot here. The rest of it's all backed away. And that's where I'm just going to have a little sit here. Make sure I'm not leaning on her upper body anywhere. Okay? Definitely, if they're pregnant, we don't want to do that. Still tanned up? No, gone away?
Yeah.
Beautiful. Okay, simple as that. So on what we did last week, where we just did a nice gentle bit of work up the side of the leg and all the broadening work, we're just bringing in a bit more deeper work around the top of the hip here. Okay? Remember, this isn't just for pregnancy, doing releases like this. Good for anyone really tight around the side of the hip. If someone is really tight through TFL as well, that's actually basically going to sit where you have the quad coming up, you get a little bit of a crease in the leg. So if you follow the quads up, and you'll feel you push into, there's ACES sitting there. Okay, so TFL is going to be sitting through here. So it's actually a really good area. You can get through that. You can do some double thumb frictions if need be. I can just get in here and work across it. Okay, you can work up and cross fibre it from the front, and again, you can do some pressure point or a work compression work through there, okay, just to free that up. And that's good for anyone that's dropping into anterior tilt with medial rotation, which is very common in pregnancy due to the weight of the belly. Okay, next point.
Okay, thumb frictions to feel for tension in external rotators.
Oh, okay. Done a lot of that. That was working through. The external rotators are going to be sitting on the back of greater trochanter through here. Alright, so that is, the external rotators are piriformis, obturator, gemellus, and down here you'll be getting quads fem, quadriceps, quadriceps femoris. Okay, so they'll be all in around the back here. Okay, if you feel a lot of tension in there, you can work through them with those thumb frictions. They want you, they're actually not too bad, nowhere near what you had through the top of the hip. So that's not the area I need to focus on in this case. Okay? Easy to use thumb frictions through there. Okay? Next one.
Long streaks to side of leg, ITB.
Yep. So if they've got tightness in the ITB, we've already worked glutes out well, we've already worked TFL, so that should take a lot of pressure out of here anyway. And go back into some of the work you did last week. Just use a little bit more pull, and a little bit more pressure if they do have. Well, if they've got sciatic pain and it's running down the side of the leg, they might be quite tender down here. So you'd have to do then very nice light work, and you basically run to what we were doing last week. A lot of that nice broadening work. Okay. Just gonna make sure. Oh, he's still high enough on that pillow. That's fine. Okay. We can do some of those circular thumb frictions. Okay. Knuckles up the side of the leg. Right, but if they aren't feeling too tender through here, that's when you can go a little bit more firm and bring in some deeper knuckle work. How's all that feeling?
That's all right.
Yeah. Don't forget here, we're not just working to the side of the leg, we've got hamstrings and quads we can access.
Cool.
I'll come back over there. Okay, so I can get right around into the front of the quads. Alright, I'm not going to be able to get vastus medius and things like that, but I can definitely get through some of rec fem. Just got to support that leg nicely. We come in with the forearm up through the quads, through the side of the leg. A very quick warm up through the hamstrings here as well. And where was that nasty area? It was
I don't know, I just felt like something.
That's the slat. Yeah, just felt a flick over the top of it. Alright, so just change your position. Work through any areas that are tight, the whole way through the thigh. Okay. Next one.
Okay, hip rotator stretch.
Okay, this is all my stretches now, isn't it? Okay, I'm going to go back to the start. I'll do all these stretches together. So you do have, after we've done the lower back, I do have the sole stretch. I just want to show you these all as one component. So stop that for a sec.